Hi, my name's Paul Kubes. I'm from Queen's University in Kingston, Ontario, and I'm the co-organizer of a Keystone Symposium on Myeloid Cells in Hannover that'll be held in March. We wanted to break barriers. We find that many meetings are so specialty driven that everybody knows everybody and nobody learns anything new. And so this meeting was all about breaking down barriers, getting rid of silos, and being able to interact with people you haven't interacted with before. We've chosen investigators that are really doing cutting edge research. So that was the first thing. I think we've got some of the best people in the field coming. And we've also chosen people that are doing some very interesting new research. So how does a macrophage that sits in a knee joint, which is moving back and forth, how does it live in that kind of environment, constantly being pounded by all these forces? So it's one example of what we hope to accomplish, is to really look at some of these environmental conditions that you and I might think are extreme, and yet the macrophage loves to live in. So those are some of the things we're trying to understand. So, I have muscle, I make muscle. Doesn't mean I use it, right? It doesn't mean I go running every day. We're gonna find out what these macrophages do. They make something, do they actually use it? Is it important, functionally? Is it important clinically? What happens if you don't make it? So I think this meeting is going to tell us a lot about all that work that's being done in transcriptomics and be able to now start understanding it from a functional point of view. I think that there's some incredibly powerful imaging that allows you to now go deeper and deeper into tissue, be able to see the immune system and its behaviors. So that's one thing that just keeps changing overnight. It's just an amazingly rapid field. So the imaging is very, very interesting. The other thing that's kind of becoming very important is I've already mentioned transcriptomics, but now spatial transcriptomics. So looking at a cell and saying that cell has that transcriptome because it's sitting next to this cell, next to that cell. And so now being able to see what every cell is doing and how it's interacting with its neighbors. So I think that from that perspective, there's some very, very interesting new techniques. The other kind of interesting thing that this meeting is going to do is it's going to bring together bioengineers, people who use very different methodology to study cells. And it's going to now apply some of that to immune cells. And I think that that's going to be really kind of revolutionary. It's going to be different from anything else that people have seen. And so I'm really looking forward to a lot of this mechanotransduction, as they call it. What happens when a cell detects a force? How does it change? What does it do? So I think that those techniques are going to be really cool to see. My feeling is that anybody who studies immunological diseases will benefit from this meeting, because I think the information we're going to gain from this meeting is what happens when you don't have disease. What happens in normal homeostatic conditions? In other words, what is your body doing right now when you're healthy? How can you study a disease without understanding what healthy is? And so I think this meeting will provide real insight into what health looks like. And then you can apply that information to say, wow, my cells are behaving differently. That's what disease is. And so I think anybody studying immunological diseases will benefit from this meeting.